Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
Well, John, you know, I look out on my porch every day and I see all these boxes out there from Amazon, and I'm thinking, is there any healthcare in here? What's the story about Amazon and healthcare 2022?
Amazon keeps talking a big game, and they actually were very impressive during the pandemic. They kept those boxes and supply chain coming when a lot of people were faltering. But they've talked more recently about getting into the healthcare business itself as a direct provider. And I think, David, in this one, I think Amazon's the great pretender. What do you think?
Well, John, they were offering a telehealth for their own staff. And now they've added 20 cities, and they've signed up some customers, including Whole Foods, which they must have known somebody there, I guess, but also True Blue, whatever that is, in Silicon Labs. However, they already had Hilton and Precor signed up, and so they want to make this service available nationwide. They're not going to open a bunch of doc in a box, but they will dispatch a clinician out to a patient's home if needed. So I think there's something there.
Really? You think but you were the kind of guy who thought that Amazon was going to be great in the phone business. What was that weird phone that they had?
Fire tablet, John.
The Fire that never took off. I mean, I think that's really, you forget that Jeff Bezos, the Amazon CEO's only external board was drugstore.com, and that was drugstore.bust.
Yeah.
They're talking about going into primary care. I mean, the whole point of Silicon Valley is that they hate people. It eliminates people infrastructure and improves efficiency and lowers costs, sometimes at the expense of people, by the way. And yet healthcare is fundamentally a personally and an emotional experience. You're going into the healthcare at the point of greatest vulnerability, and you're going to, assume that the guy with the stethoscope popping out of the Prime truck who delivered your cigarettes and bullets from a couple of weeks that they're delivered your stuff to your door, or your many complicated books, David, I guess for you, that delivery guy is going to be the same service you're going to get your primary care from. Do you really think that's a good idea?
So, John, they mentioned some differentiators, and I'm not sure what you were doing poking around in my Amazon account to see all of my past purchases, and I hope you didn't hit buy again, because I don't need any more of that stuff. However, there's a few things they said. One, on-demand access to high-quality clinicians. The second one, their kind of clinical services provider that they're working with, Care Medical. And the third one is about their seamless patient experience, that this is just sort of what they do. This is their core strength. And the last one that they don't really mention, but I think is real, which is the ability to deliver prescriptions. So, I mean, that's what they say. So, I mean, how does that stack up for you?
But David, is Dr. Jeff going to be your favorite doctor? I mean, come on, seriously. You're going to go to Amazon Prime and get your Prime doctor, which is a slightly better doctor than the doctor you could get by just going to the website and ordering up somebody else. I mean, we've got a doctor shortage in America. We definitely have some service breakdowns in healthcare, but one of the fundamental things that's breaking down is the relationship between the doctor and the patient. And you think Amazon's going to solve that? You are truly a tech optimist. In fact, you're a credulous tech optimist. This is the wrong way to fix healthcare.
I thought you're going to make a new word combining crude and something else. But John, the thing is, you got to look who they're comparing to, which is a regular physician office. I call my physician office. First of all, it better be Monday through Friday, 9 or 9:30 until 3:45 p.m. and not during lunch. And then when I call, it says, if it's important, hang up and dial 911. Great. So Amazon does a very good job of actually connecting on not the medical side of it necessarily, but on all the sort of the customer service, the seamless actual patient experience. And I think you should not tamp down on the idea that the ability to integrate more with the prescription delivery side of it. I think that's real.
Well, that's a diversion. We were talking about Amazon Care. I think for prescription drugs, particularly if you're playing in the cash part of the benefit, the part which is not covered by insurance, sure, Amazon has an edge because they're an incredible digital retailer. And a lot of people are paying out of pocket for more for their drugs than they should be. But the vast majority of drugs are still covered under insurance, and that's not a place where Amazon has shown an interest in playing. I think they're just nibbling at the edges. I mean, it's sort of like Google Health.
Okay.
the search that went nowhere. I mean, seriously, Google was sort of the bright new tech thing in healthcare a few years ago, and as I recall, you were a big believer. But now we realize it was just another argument for search. I think this is going to be another argument for retail. Big companies tend to do what big companies do well. In the case of Amazon, it's cloud-based services with Amazon Web Services. It's discounting books and other home staples to your door. It's delivery. It's a seamless customer experience because it's an easy customer experience that's been made more complicated by others. I think healthcare is really different.
So, John, let's talk about a couple of the more peripheral things that Amazon is doing in healthcare and get away from the sort of direct provision of care. So they said goodbye to Haven, because I think wasn't moving fast enough for them.
What was Haven?
Yeah, I don't remember, John. Haven was supposed to be a way that they were going to collaborate with other health insurers, in particular JP Morgan and Berkshire Hathaway, to shake up healthcare and make it more responsive to employers. So that didn't really happen. But now they've been rumored to be a buyer of Peloton. John, they're going to not just buy a bunch of bikes and ship them.
Well, now there's a good idea. Right. Finally,
okay.
From you.
Why do you like that one?
Well, think about it. It is a direct delivery product. There's a service contract that goes with it, so they can overcharge you for that, which Peloton's already overcharging my household. Yeah. It is a beautifully designed product, much better than anything like that physically that Amazon has designed it, and immediately plugs Amazon into personal local relationships with consumers who've got a lot of dough. That Peloton bike of yours, David, is very, very expensive. And you got to buy a service with it, which is a subscription service. So that cash register is ringing on a regular basis. And then you have people who look better than you, who are in better shape than you, who remind you on a regular basis that you better start exercising. But it's a beautifully designed sports experience based on an at-home technology. And I think you could see Amazon shotgunning a lot of great other retail goods and services through that channel, because what they've done, in the same way that Prime did earlier, you've stripped a sliver of the worried well who are interested in exercising, who have the money to pay, immediately carved them into the Amazon family, if you will. And I'm sure those worried well and ambitious, healthy people would be willing to spend more money. But that's David, you're just trying to pivot,
I'll tell you, John,
away from this healthcare thing. But I think Peloton is an amazing product and service, wildly overpriced. It's in trouble. And frankly, if Amazon doesn't buy it, I expect Apple will.
Yeah, maybe Nike. John, I think that we do have a Peloton, okay, but I'm hoping that Amazon buys it. Maybe
doesn't look like you've used it.
Well, it's my wife's, but maybe they're going to bundle it in the monthly service with Amazon Prime, and I won't have to pay so much. But maybe not, John. There's a few other things that they've done in the home, and some of these are pretty cool, and some of these may be a little spooky. So they've got Alexa, which I have to be careful not to activate by saying the word there. Hopefully, sorry for listeners if I've done that for you.
She's listening.
She's listening. Now, they've also expanded that. So they have something called Alexa Smart Properties, where they're actually working with senior living and some hospitals, including Boston Children's and Cedars-Sinai, to have like a drop-in capability for caregivers. And the same sort of drop-in approach is being used on what they're calling Amazon Together, so you can check on your loved ones remotely. Is that spooky for you, John, or do you enjoy not having to go visit your mom?
I think that everything they do is a little spooky in terms of having ears and eyes in the home, but people have been willing to kind of give that up for convenience of a retail experience. And I suspect that Amazon healthcare stuff is just another way to sell you more product. But I think that look, Amazon is an amazing technology company. And if you can stay more connected to your parents, me with my parents, or with my vulnerable relatives who are, as you know, my sister suffered from chronic disease, was at Boston Children's. I mean, those are extensions of what healthcare does or needs, connections with people that Amazon, because it's wired into the home with that Alexa device, really is an advantage. But that's very different than being in the healthcare business. So you're just creating a local utility. You're still not making much of a good argument here,
well, John,
David, that Amazon's going to do anything other than talk.
All right. Well, I think I've given a good survey of the things that they're doing, and we'll let the listeners decide on the impact. So I'm sure you're going to criticize me for this as some sort of a pivot, but Amazon has something like 1 million employees, and they have an interesting combination of a high-tech workforce, kind of like Facebook, and a low-tech one like Walmart. So they've got, as they've navigated the pandemic, it's been a challenge. Now they've had a big focus on workplace testing. They've been aggressive at that, securing their own supplies, doing testing, sending people home. They were really on at that to try to prevent the spread, especially in the warehouses. They had mask mandates, and now they've relaxed the mask mandate, but they've also kind of used the carrot and the stick for not vaccinating. So, first of all, the carrot is you don't have to wear a mask if you're fully vaccinated. The stick is if you have COVID and if you're not vaccinated, you don't get paid leave.
So they're basically creating a tax on the unvaxxed.
Yeah, unvaxxed tax.
I think that's probably a good idea. But that's, again, now you're talking about employee benefits. You are kind of bouncing around here a little bit. So let's mark them to market. They did a phenomenal job during COVID at keeping the supply chains going, keeping distributions happening, and really reinforcing the fact that a lot of retail should and can move to digital, and it can be a great user experience. In terms of the direct care, you haven't said anything with this whole telemedicine, doc, like this sounds like literally doc in a brown box approach. The doctor's going to come to your home. I mean, I kind of don't buy it, and there's no way they can do it efficiently. Now you're saying something I really agree with, which is that they kept their employees healthy and they're thoughtful about health benefits, but that's very different than talking about Amazon Care, David. Can we just get back on topic? Do you really think that they're going to be a credible competitor to your local doc or hospital?
I think that there is an interesting constellation of players that are going after kind of the least attractive part of healthcare delivery, which is primary care. You've got your retailers who like Walgreens, Walmart, CVS, who I think are well poised to actually do it and compete with the local doctor. And then you've got some pure telehealth players, and then you've got some that are like Amazon that are maybe more ambitious in what they're doing. If I'm a traditional physician office or hospital, yeah, I'm worried that these guys are going to eat my lunch because I do a lousy job now, and I don't treat primary care patients as customers. I treat them as like a raw material to try to bring them into my factory and make good products out of them. So I do think that all these forces are going to really transform the experience for the patient. And I think that will give some more options. Amazon's not for everyone. I got it, John, that's not for you, except for the Peloton and whatever weird stuff that you're ordering in a brown paper bag to your house. But for others, it may be just a ticket.
That's a very namby-pamby on the one hand, on the other hand kind of response. I mean, look, is it possible that they will expand their telehealth offering in a way that materially changes the opportunity to get urgent telehealth from others? Maybe, but telehealth typically is an urgent, not a chronic care kind of relationship. Your kid pops a fever, gets an earache. Do you take him to the hospital or not? That'd be something that any telehealth service could be helpful with. And frankly, that is a place where Amazon could focus. But it's really unclear what the end game here is. They can definitely sell more information. They can definitely sell more retail goods to your house. But I'm not entirely sure that they've got an end game in mind. And Bezos and that leadership team have at times gone into new markets like that old Fire phone of yours and failed. And I'm betting that they will not succeed here. I'm also betting that they will continue to come up with creative ways to manage their benefits for their employees. But David, that's a fundamentally different aspect of this question is, will Amazon fail in healthcare?
Oh, there we are, John. I think we're going to have to wrap it up there without fully answering the question. And I hope that when Amazon acquires Peloton, you're able to move up on that leaderboard a little bit, or at least off the second or third page, wherever you are now. In any case, I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for listening. And if you liked what you heard and would like to hear more, please subscribe on your favorite service.